In order to determine the physiological demands of firefighter ground operations, Indiana University's Dr. Jim Brown and his research team measure the physiological changes that occur. Here are their findings. Structural firefighting presents many potential threats to the firefighter, including the threat of overexertion. What is overexertion? Overexertion refers to a situation where an individual tries to work at a level of intensity that in time exceeds their body's capability. In extreme cases, or if an individual has an underlying heart or cardiovascular condition, this may result in a heart attack, stroke, heat stroke, or some other collapse of the cardiovascular system. In any case, overexertion causes a firefighter to fatigue. Activity causing overexertion is a result of the body placing too great a demand on the heart, essentially requiring the heart to do more work than it is prepared to do. This demand is placed upon the heart in two ways: heart rate and blood pressure. As active muscle demands delivery of oxygenated blood, heart rate increases to match blood supply to this demand. A fit individual's heart pumps more blood with each beat. Therefore, to accomplish a specific job task, a fit heart beats fewer times, meaning it does less work. This also means that the less fit heart will reach overexertion more quickly. In addition, a heart with an underlying and often unknown pathology can be overtaxed quickly, resulting in a catastrophic event. Another condition that puts any heart at risk is dehydration, or the lack of adequate body water. Unfortunately, we have the ability to lose water faster than we can replace it, regardless of what or how much we drink. The conditions firefighters experience inside their PPE is referred to as an uncompensable heat stress environment. In other words, the PPE eliminates your ability to cool yourself. In order for your body to lose heat, sweat must evaporate from the skin. Sweat that drips from the skin or is absorbed by clothing does virtually nothing to cool us. In addition, heavy sweating that occurs inside the PPE results in a further loss of body water without effective cooling. Complicating matters is the fact that many firefighters report to a scene in a dehydrated state. Therefore, even a fit firefighter who reports to a scene in a dehydrated state is susceptible to overexertion. This overexertion results because a lower circulating blood volume causes the heart to beat faster in an attempt to meet working muscles' demand for blood flow. The other factor affecting work of the heart is blood pressure. Blood pressure is the pressure the heart must overcome to move blood through the circulatory system. Any factor that increases the pressure in the vasculature system effectively raises the work of the heart. Although this is a normal effect and is essential for the movement of blood around the system, excessive pressures put too much stress on the heart, causing overexertion. This effect is exactly why the condition of hypertension or high blood pressure during rest is known to be a risk factor for heart attack and stroke. During fireground activity, all job tasks result in elevated blood pressures. Overhead work like pulling a ceiling, especially when using heavy tools or lots of force, has the potential to raise blood pressures excessively. Other activities such as crawling, walking on your knees, ladder climbing, as well as the use of heavy tools can also cause significant increases in blood pressure. Whether or not these activities result in overexertion is dependent upon the firefighter's level of muscular strength and endurance, as well as his or her heart health. So, pulling a ceiling or throwing a ladder causes less of a blood pressure increase for a stronger, more fit person. Now, we see that overexertion is a relative term, different for every individual. Whether or not a particular task causes overexertion is dependent upon the work at hand and the firefighter's fitness level. Unfortunately, there has never been any scientific study to investigate the physical demands of firefighting. That makes it difficult to design fitness training to best prepare firefighters for work. This formed the basis for Dr. Brown's research. In order to investigate this demand, 56 professional firefighters were recruited to wear a physiology monitoring system that recorded cardiovascular and respiratory physiology as well as physical activity during work shifts over a 6-month period. During this time, data were collected from 116 working structural fires. This allowed Dr. Brown to identify the physiological responses of the 4 most physically demanding job tasks on the fire ground. Let's look at these one at a time. Fire attack typically begins by pulling 2 sections of dry hose and a nozzle weighing in excess of 40 pounds off of the truck. The muscular effort required for this task initiates the physical stress associated with fire attack. In response to this effort, heart rate and blood pressure increase proportionally to meet the work demand. As the line is charged, the weight of the water is added to the hose and the firefighter assumes a crouched or crawling body position to advance the line. This body position causes a compression of lower body vasculature, resulting in a further increase in blood pressure. High levels of force generated from arm, leg, and core body musculature to advance the line toward the fire results in additional increases in heart rate and blood pressure. In some cases, the firefighter must be prepared to rotate their upper body about the spine in order to extinguish the fire. In order to accomplish this motion, the core body musculature is stressed further, especially the hip flexors and low back. Another physically strenuous job task executed on the fire scene is the interior search and rescue operation. Executing a right-hand search pattern requires firefighters to assume a crawling posture. While maintaining 3 points of contact with the floor, the firefighter uses their right hand to probe the environment. Primarily, core body musculature is used to execute this movement, making strength and flexibility in the back and abdominal muscles essential. In the event that a search turns into a rescue, these same muscle groups are utilized to move the victim's body weight in addition to that of the firefighter. Therefore, core body strength and flexibility are an absolute must for fire ground operations. The exterior ventilation of a burning structure typically involves positioning ladders to access roofs as well as the use of saws and hand tools to achieve ventilation. Although not an interior operation, this job can cause significant physical stress to the firefighter. Depending upon the structure size and type of construction, an individual firefighter may be required to carry, erect, and scale ladders weighing in excess of 100 pounds. In addition, this work is often done while carrying hand tools or chainsaws weighing in excess of 50 pounds. Once on the roof, the firefighter may be required to assume awkward body positions to use the tools. This places severe stress on the body's core musculature as well as the arms and legs. Strength and range of motion in these prime movers is essential to prevent excessive stress or injury. Heart rate changes during exterior ventilation are generally proportional to the demand of physical work. Although the effect of adrenaline is present, it is generally more subdued than that seen in the interior operation. When circumstances introduce sources of emotional stress, such as excessive fire, uncertainty about roof integrity, or perhaps a personal connection to the fire scene, the adrenaline release may drive and maintain the heart rate and blood pressure at very high levels. Overhaul of a fire scene may involve several different tasks, most of which generally require high levels of physical power output. As a result, overhaul often results in the greatest amount of physical stress endured by firefighters. For instance, the use of pike poles, shovels, and other overhaul-associated tools requires generation of large muscular forces. During overhead work, muscular strength and endurance of the upper body may be severely taxed. Shoveling or other work executed in a bent posture requires similar forces generated by the lower body and the core body musculature. Therefore, a firefighter's ability to execute this work over extended periods of time requires the body's core, shoulder, arm, hip, and leg musculature to possess both good muscular strength and endurance.